Hey, everybody, it is February 1st, 2024. Welcome to Cardiac Health Awareness Month right here on Frank About Health. That's what this episode is going to dedicate the next hour to. I'm with my correspondent, my monthly correspondent, Karen Ross, where we did the 100th show together right here at the Hilton Doubletree Chicago Magnificent Mile. And I just thought this would be the perfect place for us to start our month-long, well, not month-long, but monthly tribute for each month, starting with this one, Cardiac Awareness Month. I don't know if I'll always be in Chicago each month, but we definitely will use Hilton in some form or fashion. But the two of us will kick it off. And then what I intend to do throughout the rest of the month is other shows will touch upon cardiac care while they also talk about their corresponding health issue. The reason why I'm reformatting the show in this way is to create a continual thread, a continual narrative on how the viewers and listeners of Frank About Health will continue to use the information that we share on the show as a way to continue self-advocacy, self-monitoring, self-care, and working with the right professionals that are taking care of their particular illness. But again, this is Cardiac Care Awareness Month. I will first issue my disclaimer. Please keep in mind these are not the views of TalkRadio.nyc or of Frank About Health, but rather the conversation that we're going to have today with our two lovely guests sitting here in the wings with us, while Karen and I also will give an overview of what the month means. At the same time, any information that you do gather from this show, if it is useful in consultation with your primary care physician or your cardiologist in this case, please know that we are doing our best to give you more information than you probably already have. If you, however, do not feel that these views mirror your situation, that is fine. We're not meant to dissuade you from your ongoing treatment. We're just here to provide food for thought. That being said, I'm going to introduce Retha Gray, a continuing regular here on Frank About Health, and then Karen will interview our extra special guest afterwards. Everyone knows Retha Gray just by her name alone, or if you're watching Retirement House on TikTok, keep that in mind. It is right now 5.4 million viewers and growing, I believe. But at the same time, we just came back from a project in New York. She was doing some TikTok stuff, and I was doing some stuff for TalkRadio.nyc and Hilton Hotels. And we were able to really gather literally in the rain and in the cold, but at least really understand that we're doing our best to continue our own advocacy work. Now, Karen, I'd like to first again welcome you as always, but I'd like you to introduce your guest.
Thank you. And I'd like to introduce a good friend of mine. She's been a friend for many, many years, Donna Hepfinger. And she hails from here in Illinois in a far northwestern suburb. But Donna has had some heart issues over the years and interesting developments around that condition that I think it will be very beneficial for our listeners to hear. So we'll get her story and Retha's story in a little bit. And I think all of the listeners will benefit from this.
And I also want to make everyone aware, if you were here last February when I did a 3-episode summary of heart health awareness, we were looking at Retha Gray's presumed heart attack. She did not have one. That's what we learned after the fact. While I understand that Donna has had an incident with her heart and some intervention with it, whether surgical or otherwise.
Yes, she had an open heart surgery, and we'll let her tell the story. But yeah, it's pretty fascinating.
So throughout the show and the remaining 45 minutes, we're going to compare and contrast the two stories and show that while the symptoms mirrored each other, one was heart-related and one was not, which brings us to the theme of this episode, which is to show the difference between females with heart symptoms versus males. And we've discussed how a lot of male diagnosis, or rather doctors are using the clinical diagnosis that was originally just on men.
Absolutely.
So we want to be able to diffuse that, bring some more awareness. And I know both Retha and Donna, I'm sure, can even shed more light based on their own individual circumstances. So that's basically what this show will be about. First of all, Retha, welcome back. And nice meeting you, Donna. I'm looking forward to hear all about your story. did you want to first give some information, or should we just go into discussion?
Well, I'll give a little bit of information because this brought up you remember I had a radio show for a number of years here in Chicago.
Yes.
And one of my early guests was Dr. Steven Sinatra. I always think Frank when I when I think of him. But he was really the first doctor to really acknowledge and get the information out there that, hey, heart disease in women is completely different than it is in men. All of the statistics have been made based on research with men, and it's very different for women. So I'm going to be just kind of interspersing some information from Dr. Steven Sinatra over the 45 minutes or so. And just to give you a little idea of where he comes from, he is a board certified cardiologist and a certified psychotherapist. And he unfortunately passed away in 2022, which I just discovered in doing this research.
Wow.
And I was hoping that, wouldn't it be cool if I could even get him on the show? Well, it's not going to happen. But
Exactly.
anyway, he just passed away in 2022. He wrote a number of books. There is still a website in his honor with all of his work, and it's called Heart Institute, HeartMDinstitute.com, if anybody wants to take a look at his work. But anyway, he's written all of these books, and so we'll reference some of his information as time goes on, but just as kind of an overview.
Yes.
Heart failure is the leading cause of hospitalization in women over the age of 65. Now, I think that is a surprise to most people. I really do. And that somebody didn't just make that up. That's according to the American College of Cardiology. And it's actually often overlooked in women's health issues as a women's health issue. The symptoms are different than men, and yet the ratio of men to women is closer to 50-50 these days. So one would think the research would go in that direction also. So in a little bit, we'll talk about the symptoms, and I'm sure that Rita and Donna will reference what they experienced from that perspective.
Right.
But one of the natural disadvantages that women have is our arteries are smaller than men's. So therefore, the blood circulation just is not often as dynamic as it is in a man.
Leaving room for a lot of misdiagnosis.
Absolutely. But just a couple of statistics. One person dies every 33 seconds in the United States from cardiovascular disease. That's 1 in 5 people, 1 in 5 deaths overall. And with women, it's 1 in 4. It is the top killer of both men and women, claiming 1 in 4 women every year. Women constitute more than half of cardiovascular deaths, yet they represent only 1/3 of diagnosed heart disease. So there's a real problem there, and yet it's diagnosed in 70% of men. So
amazing.
Yeah, it really is. So yeah, let's move to the stories and find out what these women experienced. And I think some of our listeners may relate to one or both of them, or have. I think our goal, Frank, is that a woman's going to be listening, or a man is going to be listening,
right?
And they're going to say, you know what, I haven't been paying attention to something, and now after I've heard this show, I'm going to take some action. So I think that's one of the things that could be a result of the show today.
No, I agree. And other than the fact that we're both wearing red.
Yes, that's the color of heart. And I told Frank, a good friend of mine bought me these glasses, and I thought this might be overdoing it just a little, bit. Our red tops, and Frank just happened to bring his
red
jacket with him, so we're dressed to honor the month, and I think some other organizations are doing that, but it is the color of American Cardiologist Month.
Yes.
Yeah.
and for the tribute of the month and
Right,
also the charities. I guess because I think we'll be headed for a commercial break in about 3 or 4 minutes.
Okay.
Let's do a recap on Retha from last year and then get the fresh perspective when we return. And then, of course, learn about Donna and see how they both compare. So, Retha, welcome back to Frank About Health. This is your 10th show.
Whoa.
Yes, I remember all the numbers. You've pointed that out to me many times. But when you're ready, explain what happened last year for those that did see the shows that we brought down about your symptoms and we were learning about plaque removal. It really was irrelevant for what you went through. So why don't you explain your story from last year? Oh, unmute first.
Okay.
Yeah.
Now I'm
Okay.
unmuted. My adventure last year had nothing to do with my heart. No one diagnosed me with anything about my heart except for people who knew me, who made an assumption because I passed out that I had had a heart attack because I had had an event and several events between 2009. That's the only date I actually remember when I did actually have a cardiovascular episode. So last year, I basically passed out through people calling each other and realizing I was not answering my phone. I could be dead and I would answer my phone. So they assumed that something horrible had happened. They were able to get in and I had passed out. I was taken to the hospital. They told the hospital that they thought that I had had a heart attack. I had not had a heart attack. I had recovered and was screaming bloody murder by the time we got to the hospital. Don't take me in there. I want to go to my hospital. I don't want to go there. At any rate, it resulted in 3 or 4 days of me being suspected of having some type of heart attack. And they wanted to do the thing where they stick the scope up your veins and look and see if you have anything closed. It's like, I'm not having that here. I'm not having if you can't realize I'm not having a heart attack, I don't want you looking for one. So ultimately, they transferred me to my regular hospital. I told them what it was. All through this, they had tested me for sepsis, and they knew I had sepsis. But the other hospital kept playing the other scenario. My hospital said, "You're right. We don't think it's a heart attack either." But to get more on the subject of what we are going to be talking about is my first heart. They call almost anything that stops the regular working of your heart a heart attack, which I get now. So I had a burning in my chest, and it was unbelievable burning in my chest. So I called 911 myself and had them come and get me. And then they took me back to the hospital. I had a fine EKG. I was acting perfectly normal. I didn't feel sick, anything other than the burning in my chest. And so they said, well, we can't figure out what it is. And I said, okay. And they said, well, you can go home now. I said, nope, I can't. I am too sick to go home. So I will sit in the lobby. I will sit in the hall, wherever you would like me to sit, but I'm sitting in the hospital. And they said, okay. So they did, and I forget the name of the test, but they test for a element that's in your urine that shows whether or not your heart had been in stress anytime in the recent past. And that's how they discovered I was having a heart attack.
We're about to take our first break, but I want to hear more about that particular hospital because this is an example of where they looked at symptoms, made an assumption based on your history, but we're not really looking to get forward until you advocated for yourself. So this is a pivotal moment. We'll be back right here on this episode of Frank About Health. Karen and I are celebrating Cardiac Awareness Month right here in Chicago. We'll be back in a few minutes.
We're celebrating it.
Are you a conscious co-creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour Awakening Humanity, Thursdays 12 noon on TalkRadio.nyc.
Are you a high-achieving, growth-oriented leader? Are you interested in developing your authentic leadership while creating a healthy, inclusive workplace? Hi, I'm Dr. Mira Brancu, host of The Hard Skills on TalkRadio.nyc at 5 p.m. Eastern on Tuesdays, where we discuss how leaders develop the hard skills needed to make a greater impact. We interview experts, have live coaching, and tackle these challenges. Listen to The Hard Skills on Tuesday at 5 p.m. Eastern on TalkRadio.nyc.
Are you a business owner? Do you want to be a business owner? Do you work with business owners? Hi, I'm Stephen Fry, your small and medium-sized business or SMB guy, and I'm the host of the new show, Always Friday. While I love to have fun on my show, we take those Friday feelings of freedom and clarity to discuss popular topics on the minds of SMBs today. Please join me and my various special guests on Friday at 11 a.m. on TalkRadio.nyc.
You're listening to Talk Radio NYC. Uplift, educate, empower.
Welcome back. We were just hearing from Retha about the misinterpretation of the symptoms of a heart attack. And I wanted her to recap what she described. And I know you went to a particular hospital that has an excellent reputation. Do you want to mention it? And then, of course, point out how they were able to see the difference versus the original hospital you went to?
Well, again, we're talking about two different episodes. The first one in 2009, where I'm saying there's something wrong and the doctors are saying there's nothing wrong with you. And
Okay.
the last episode from 2003, when they were saying you're having a heart attack, and I'm saying, no, I'm not. Find out what's wrong with me, but that's not what I'm doing right now. So the reason I was aware even the first time for 2009 was I had gone to an independent company who goes into the neighborhoods, charges you less than what a doctor would charge you to do scans of different parts of your body.
Yeah, I've heard of that. I think it's called Life Scan.
It
And
is
they
Lifeline or something like that.
scan the whole body and tell you got kidney, heart, whatever. Yeah.
Exactly. So because my father had cardiac issues. My mother had cancer issues. My father had cardiac issues. I was constantly on the lookout for cancer. And it occurred to me, I never even thought about my heart. My father died at 48. Why would I not be thinking about checking out my heart? So I went to this private thing and they said, your artery here is clogged, but it's not clogged enough that they're going to do anything about it yet. But you need to keep an eye on this artery. So I would go in every couple of years and have them check the artery. Well, this time that I had the burning in my chest and finally said, I'm not leaving. And they took the test to see that my heart was under stress. And then they did the ultrasound on my neck and they said, there it is. It was 99% closed. So they said, well, we got to take you to the emergency room in our emergency surgery. Well, I had been there for like 24 hours at that point and had not eaten, except I had just eaten the biggest, juiciest fat burger you've ever seen in your life. And they're talking about taking me to surgery. And I'm saying, hold on. Everything that's in me has heard that you don't have surgery on a full stomach. I have a
Right,
very full stomach. Can we wait until in the morning to do that? Plus, it's late at night. You don't have a full anything here. Can't we wait until in the morning? So we did. And it
Okay.
was an issue. I still have a little scar to remind me. And they went in, and speaking of women's veins being smaller, my artery there was so small they couldn't put a stent in it. So they
Ah,
had to just scrape it clean and sew it back up. So
Wow.
between then and now, I've had different problems, but never anything where they had to do because it's not my heart really that's the problem. It's the plaque on everything that connects to my heart that is the
right.
problem. So I've been very fortunate. They caught that one. I've had a total of 6 stents put in, uh, always without the regular symptoms of. I've never had an elephant sitting on my chest. I've never, done any of the things that they claim that you will do. But I have
Yeah.
6 stents that show that my arteries are not pumping correctly
Yeah.
or letting it flow correctly.
Well, maybe this would be a good time for me to run through some of the symptoms
Sure.
that are different for women. And then we'll talk to
Donna.
Donna, and she'll tell us her experience with symptoms. But,
Yeah.
we think of, like Retha was talking about, the elephant on your chest, and men talk about and you see heart attacks that men depicted on TV or in movies. They clutch their, so on. But with a woman, there could be discomfort, pressure, or pain in the chest that could happen, and their back, tingling or pain in the jaw. I've heard that about women, never heard it about men.
Mhm.
Elbow or arm. Now, both men and women tend to feel pain in the left elbow or arm when having a heart attack.
Okay.
But with women, it could be sudden, profound fatigue, shortness of breath, tightness in the throat, dizziness or vertigo, indigestion, nausea or vomiting, disproportionate sweating with anxiety. So some of these things just never show up in a man. And when they show up in a woman, they don't even think heart attack. So I'd love to hear Donna's story. Tell us what happened with you and what were the subsequent treatments.
Unmute.
You have to unmute.
Yes.
Okay. So over the years, I knew I could possibly have a problem because I had gone to the emergency a few times, but it was never anything dramatic enough to tell me I really had a heart condition. But this time, I woke up early in the morning and I was doing Qigong of all things. And all of a sudden, I just, how you just know. And so I woke my husband up and I said, you got to take me to the hospital. I didn't know why. I just knew.
Well,
So
what did you feel? What did you feel? You knew, but what did you feel, and what did you feel
Well,
you knew?
it wasn't chest pain. It wasn't dizziness. It was weakness, but it was all in my abdomen.
Ah.
I felt, just kind of queasy. And I knew I just knew something was wrong. So kind of a premonition. So when I get there, they did all the tests that they could think of that would go with your gut. And then I was about ready to be sent home because they couldn't find anything that indicated a problem. And so my primary doctor, they called him. And he said, well, before you send her home, do a stress test. Well, when they did the stress test, I failed miserably.
Wow.
And so then they scheduled a the test where you go up through the groin. Yeah, I had it on the tip of my tongue.
Yeah, I know which one. I can't think of it either.
It's okay.
So I had that test, and of course, that was a problem. They said that I needed to have open heart surgery. So that was a shock because, I wasn't being medicated. I wasn't anything. And they were going to send me home and would have, but didn't. So they did the open heart surgery, and they said that I ultimately had a triple bypass because the arteries were pretty close to 100% blocked.
Whoa.
And
Wow.
no chest pain, not the symptoms you hear about men having. And then, since then, I've had, well, you mentioned the small arteries. Well, during the surgery, they would have done a couple of more bypasses, except they said they were just so tiny, and they didn't want to keep me on the table any longer than they had. So then I would say 3 years after that, I had another episode, but again, no chest pain, just more of that queasiness, the weakness. And they determined after doing another test through the groin that they needed to put 2 more stents in. And those probably were the ones that they didn't do when I had the first surgery. But I'm truly a heart patient, I guess, because now just in this last 6 months, they've told me that my mitral valve is failing. So it's like halfway to having to have a replacement. And they told me that I might have to have open heart surgery again.
Oh, dear.
And I said, oh, really? Because, you get your chest cut one time, you think that's about enough.
Yeah, right.
But they said no. Sometimes they can go up through the groin and go all the way to the heart and fix the valve, but it depends on how bad it looks, So for right now, I'm on hold, and I said, well, what symptoms should I look for? Because he sent me home. And because I don't get chest pain. So what do I look for? How do I know I'm worse?
Right.
And he said, well, you could get dizzy, which I've had. I've had episodes like that. And of course, weakness. And I could have, that funny feeling in your arm or something like that. And shortness of breath. So
do we need to take a break?
Yeah, we do.
Okay,
Because
we'll come back.
in some ways, I'm just amazed that there are similarities between you and Retha, but also it seems as though it's probably something that I want to explore in the third segment about why there seems to be I don't know if the word is laziness, but a tendency, a resistance to find the diagnosis as quick as they should, or in my view, as they should.
Yeah.
That being said, we're going to be back right here in a couple minutes, right here on TalkRadio.nyc and on our YouTube, Facebook, LinkedIn channels, and Twitch. Please stay tuned. We'll be back in a few.
Hey everybody, it's Tommy D, the nonprofit sector connector, coming at you from my attic. Each week here on TalkRadio.nyc, I host a program, Philanthropy in Focus. Nonprofits impact us each and every day, and it's my focus to help them amplify their message and tell their story. Listen each week at 10 a.m. Eastern Standard Time until 11 a.m. Eastern Standard Time, right here on TalkRadio.nyc.
What really drives success in business? Introducing Intangify, the show that explores the intangible assets that create value and growth. I'm Matthew Asbell, your host and an attorney focused on innovation. Join me Fridays at noon Eastern to discover how innovation, culture, and other intangibles shape thriving companies, from startups to established businesses. We'll share strategies to unleash your business's true potential. Tune in live on TalkRadio.nyc, Fridays at noon Eastern, and Intangify your business today.
Were you an essential worker during the pandemic? If you needed to learn stages of epilepsy, did you depend on advocates? Did you use new innovations to cope with mental and neurological issues? Maintaining high quality of life and keeping good mental health are what we all strive for. I'm Frank R. Harrison, host of Frank About Health, and each week top healthcare influencers, professionals, and innovators answer these questions and more. Stay tuned on Thursdays at 5 p.m. on TalkRadio.nyc, and I will continue to be frank about health with all of you.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Hey, everybody, and welcome back. Just hearing Donna's story right now, I mean, as I was talking during the break with Karen, I'm stunned, but I think that Karen will now put some light into what Donna was talking about and probably also answer why is the healthcare system overlooking female cardiac symptoms not as easily as they treat male. And so I guess I'm looking for more coherence.
Okay. I wish I had the answer as to why, Doc, but hopefully we're getting closer to that. I really do hope so.
Right.
And I want to hear the rest of Donna's story, but just going through my notes, here's another comment by Dr. Sinatra. Sometimes women's symptoms are mild enough for them to think they just have the flu, or doctors may misdiagnose signs of heart disease in women as others, less serious conditions like hypoglycemia, indigestion, muscle strain, or simply just anxiety or stress. Right. And before we close today, I have to give you more information on stress and some of the things that Dr. Sinatra talks about in avoiding health issues or heart issues. But Donna, do complete your story, please.
Mm-hmm. So where was I? I was at the point.
Well, that you may have to go back. This valve may, but you just don't know. You're kind of on wait now to find out if this other valve needs to be replaced.
And when I first went to this cardiologist, he wasn't willing to. He had done excuse me, an echocardiogram, and they usually give a my chart report, but he didn't do that, and I got a little suspicious. So when I went back in to see him, I understood, because when he came in, he sat down and just kind of looked at me, and he said, "Well," he said, "there's a problem," and he said, "Probably because of my history." He said, "Ordinarily, based on your echo, I would probably encourage you to have another open heart surgery now, but you look too good." So he said, "Because you don't look like," I'm 80. So he said, "You look more like 60. So he said, "I'm scratching my head because your tests look kind of bad." So he was going to talk to people in his group. And so we talked over the phone like we're doing now. And he said, "Well, we'll wait another 6 months." So I get to continue with my meds. But I guess if you have a history of cardiac, they do pay attention. Like if you go to the emergency room, they're not going to send you home, especially if you just have stomach issues.
Right. Well,
So-
one point I'd really like to make is we're talking to two women who've had some pretty serious conditions and treatments, and look at them. They're both healthy, vital.
Yes.
Retha, I frankly don't know your age. I don't know if you want to share that with us.
I'm 74.
Okay. And Donna's 80, and both vital and involved. And so one of the other messages that we want to get across is that you can live with conditions
Yes.
once you know what's going on and know, how to take care of yourself. One of the other things that I was looking at with Dr. Sinatra's work was, what did he recommend? And I'm sure many other cardiologists to take care of our health.
Mhm.
And with women, stress and what was the phrase he used? Emotional turmoil tends to have a much more far-reaching impact on a woman's physical heart than on a man's. And so stress and emotional upset really have to be taken care of, and we have to keep our stress down. Beyond that, he said that often lifestyle changes have more of an impact sometimes than medication,
Mhm.
and we should avoid, unfortunately, I know sugar's on the list, darn
I'm sure it is.
it. That's the rough one, but processed foods and alcohol, kind of stay away from alcohol, processed foods. And then when I came to sugar, and I thought, oh no. But yeah, they really, really stress lifestyle changes. And that's really important.
Karen, the thing that I'm drawing from this is that it looks as though that from women's cardiac issues, correct me if I'm wrong, and please acknowledge the disclaimer I said at the beginning of the show. Are doctors treating women's cardiac issues as a mental health issue, or are they overlooking it?
Oh, that's an interesting thought.
Maybe they're looking to make
it a mental health rather than.
Well, no, I think if they see the comparison of it being more motivated by mental health
Mhm.
issues, then it could be a more holistic type of approach towards dealing with the symptoms instead of rushing to surgery.
Right.
Or like in Donna's case, being told, wait and see until you're ready for surgery. Or Retha's case, when you knew that they wanted to test you for surgery and you had your hamburger. I mean, it's like I feel like I was watching an episode of Grey's Anatomy where they're looking to cut. What I understand is it just a disconnect? They're looking for the quick.
One of the things that one of the doctors said to me, because I've had, I think, 3 hospitalizations to put stents in. So after the first one, they were saying, well, your arteries you've got bad cholesterol hanging on to your arteries. I said, well, let's do a full scan and let's go in and put plugs everywhere. And they said, it doesn't work that way. And their reasoning behind that is, if we look for bad arteries, we will find them. You may have lived another 50 years with that bad artery, but because we find it and we tell you we find it, you're going to insist that we go in there and fix it. We can't do that. Well, everybody's got bad arteries. Your body can heal itself. It's when it gives a problem. So that's the only time they'll really even talk to me. Are you having a problem? No. Then in 6 months, I'll see you.
So is it fair to say then that in women's cases, especially when you're having symptoms that could be or might not be a heart attack, that you better be your best advocate, because that appears to be where you're going to get the most treatment when the truth is out there?
And I think it's universally true about women and male doctors across the board. It's not, my uncle and my grandfather were both doctors. My grandfather told me, don't let them cut on you unless they absolutely have to. And he was a surgeon, and because he said, we're practicing medicine. We don't always know what we're doing. We're practicing. And I think with women, men look at women as being more hysterical and histrionics. And so they think that, you're exaggerating the pain or whatever. And I think that's still universally true. I think it's been all through the ages. They just don't take us as seriously, or they blame it on the stress that we're under. And I don't know if that's ever going to change, but I know I have a woman doctor.
I think that helps. What do you think, Donna? Have you had a sense of, and I'll just say that's one of the things I like about Dr. Sinatra's work is the fact that he's a cardiologist and a psychotherapist. So he's in touch with the psychology of the person. Right. And I'm glad he chose women to really focus on. But Donna, did you find some of that? I don't know if I want to call it a conflict, but what did you find in your medical treatment?
I would say that, yeah, when I went to the hospital and they ended up doing open heart surgery, yeah, I mean, they weren't looking at me as a patient that was in a big problem until I had the stress. And most of it was, I mean, my doctors have all been, my heart doctors have been men. And for the most part, I thought they did a good job. But if I look back on my life, I probably had stuff going on with my heart for years. And I was a psychiatric patient years ago. And yes, everything I came in with, they said was in my head. And it was a lot of gut stuff. So I have a feeling, that I had it all along and I just didn't know it. And the stress that led up to that surgery, my husband had I think he had a stroke by then. And so I was taking care of him. So, yes, probably stress led to the crisis.
Sure.
Right.
But since what I want to say is since you mentioned things we can do for ourselves, I think the reason I do so well is because I walk every single day. Even if I walk in the house, I set the timer and I walk in every room. And my diet is probably not as good as it used to be because I figured, since I had to have open heart surgery all those years that I denied myself, so that's not okay. So I do treat myself occasionally.
Good.
Well, we're about to take our final break, but 2 talking points that I want the listeners and viewers to have out there is, remember that if you are a female with a heart condition, whether it's mild or whether it's extreme, be your own best advocate. Number 1, this is one of those conditions that you have to be a fighter. Second, it's just my view, but I think what another Frank,
yeah, right.
Although his name isn't Frank.
No, it's Stephen. But
Dr. Sinatra. He was basically using the mental health angle to really understand and shed light on what things that probably in both Retha and Donna's case, the doctor did not see, or they were more focused on the end result, which is some surgical intervention. So that takeaway is maybe one way to easily diagnose it, whether you are the patient or if you are the medical professional, is to look at the mental profile of the individual and their history, because both Retha and Donna said it. They were diagnosed based on their history, not based on the moment. So it is up to, and this is just my takeaway, it is up to those individual women with cardiac duress to be a fighter and bring to light the mental aspects of what probably led to the ongoing circumstance. So please stay tuned as we wrap up the beginning of Cardiac Awareness Month right here on Frank About Health, both on TalkRadio.nyc and on Facebook, YouTube, LinkedIn, and Twitch. We'll be back in a few.
Are you a high-achieving, growth-oriented leader? Are you interested in developing your authentic leadership while creating a healthy, inclusive workplace? Hi, I'm Dr. Mira Broncu, host of The Hard Skills on TalkRadio.nyc at 5 p.m. Eastern on Tuesdays, where we discuss how leaders develop the hard skills needed to make a greater impact. We interview experts, have live coaching, and tackle these challenges. Listen to The Hard Skills on Tuesday at 5 p.m. Eastern on TalkRadio.nyc.
Hey everybody, it's Tommy D, the nonprofit sector connector, coming at you from my attic. Each week here on TalkRadio.nyc, I host a program, Philanthropy in Focus. Nonprofits impact us each and every day, and it's my focus to help them amplify their message and tell their story. Listen each week at 10 a.m. Eastern Standard Time until 11 a.m. Eastern Standard Time, right here on TalkRadio.nyc.
Are you a business owner? Do you want to be a business owner? Do you work with business owners? Hi, I'm Stephen Fry, your small and medium-sized business or SMB guy, and I'm the host of the new show, Always Friday. While I love to have fun on my show, we take those Friday feelings of freedom and clarity to discuss popular topics on the minds of SMBs today. Please join me and my various special guests on Friday at 11 a.m. on TalkRadio.nyc.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Hey, everybody, and welcome back to our final segment. I have to say to both you, Donna, and you, Retha, you have already shown to be advocates with your heart health, especially you, Retha, in knowing it wasn't a heart attack, and yet they were insisting that it was, and you stayed and stayed and stayed until they treated you for the very instance you had. And you, Donna, to be dealing with the stress of your husband's stroke and to also already be having your own symptoms from other stress-related issues, whatever they may have been. I'm glad you were able to survive that first open heart procedure. But at the same time, when I listened to your story about you're waiting to find out if you need another one, to me, that doesn't, to be frank, wash. So I think whatever you know from your own research, your own professional background, your own treatment care, definitely, I hope while you're waiting, you're at the same time doing whatever necessary research there is to see if there is another alternative to the valve issue other than just getting it replaced. But I'm sure you're using your best judgment. I think the takeaway, and tell me if you agree, Karen, is that both of them are here being vital because they still had a voice in their situation.
Absolutely.
And it's unfortunate that most don't, I guess.
No, that's true. That's true. They just follow blindly and don't do their own research. An interesting point, Donna mentioned taking care of her husband. I knew her husband, and I knew when he had the stroke. And there's another aspect of heart disease called broken heart syndrome. And that's been alluded to, and I think a lot of people have kind of poo-pooed it. Well, Dr. Sinatra says that it is, it's a recognized phenomenon. It's also called stress-induced cardiomyopathy in medical circles, and often strikes after times of extreme stress, such as the sudden loss of a loved one, when the rapid and intense release of stress hormones literally stun the heart. Wow. Well, I listened to that and I know what Donna went through, and not only taking care of her husband, but then losing him. And I mean, there's no question, I believe, that she has suffered from broken heart syndrome. And thank God she's taken care of herself and come back from that. So I think I'd like to hear from both of them before we close the show out.
Oh, absolutely.
How they'd like to leave the audience with what message.
Absolutely. I mean, I'd just like to add, if they always, Valentine's Day is coming up February 14th.
Yep.
And they say that sometimes dark chocolate is good for the heart because there's less sugar and there's more. So maybe when feeling blue, take a lot of dark chocolate. It can help. Of course, I'm just talking from the cuff of my head, whatever, I really, aside from my own little simplistic solutions, I definitely would like to hear from both of you as to what you can recommend other women to be on the lookout for and how to further fight for their heart health.
Definitely.
Well, I heard they had a meeting at some government this morning condemning the bad things that are connected with social media, but it also can be used for good. You can research things that you never could research before. You can look up the side effects of your medications. If you're feeling side effects, don't let them tell you you're just getting old. It could be something real, mainly side effects from the statins that they give you. They don't tell you how horrific some of the side effects of statins are. But they'll say, but you need this, and you take it mindlessly. And when you can't get out of bed, you call the doctor and they say, oh, it might be the statins. I've been in bed for 6 months already.
Yeah.
So you have to know your own body. Like you said, you have to eat well. I'm not the best person to talk to about that, but you should eat wholesome foods. And you do need to exercise. Like you said, if you just walk around your house, stay active. If you lay in that bed, you will stay in that bed.
Mm.
And if you're at a hospital or a doctor, they do know more than you do, but they don't know more about your body than you do.
So they have to own their knowledge and share it with them while they're in the investigative process of the condition.
Exactly.
Donna, what parting thoughts would you like to leave for our listeners?
Well, I would probably encourage people I really called what I had when I had to have that surgery a gut feeling. And it was in my gut. But if you know somehow that there's something big going on that they're not seeing, definitely speak up and just ask a lot of questions. And if the medications are bothering you, stand firm about it. Find something else. So.
Yeah. And Retha is correct. I'm very anti-medication. I really will fight a doctor before I'll take something, but I had to take something for a while. Yes. And all of a sudden, I looked down at my feet and my ankles and my lower legs were swollen. I thought, what is that about? And I didn't even initially connect it. I thought I'd eaten too much salt. I'd sat at my desk too long, so on. And then I finally had a conversation with the cardiologist nurse, and she said, oh, well, that's the medication. But just kind of blasé. Yeah. And I said, well, I'm not going to walk around with these feet. Anyway, you got to speak up, speak for yourself, and advocate for yourself for sure.
And speaking about Karen Ross now, what would you say about?
Yeah, I forgot about that.
No, no. I mean, because we were hypnotized with these two beautiful women
right,
here.
That's right. That's right.
But I'm just wondering, would you say that hypnotherapy might be a solution for people with heart health on some level?
Absolutely, because what I do in hypnotherapy is I help people develop a sense of peace and calm. And so particularly those who are in a stressful situation or troubled by some physical condition that they're going through, we can either transform that. Sometimes we can totally relieve it in the case of chronic pain, but we can always bring somebody a sense of peace and change the perspective about what they're going through. So I appreciate you reminding me that I do have a business. And it is KarenRossNow.com. And I welcome complimentary conversations with people to find out if it's the right thing for them. Yes. And then if anybody's interested in following up on Dr. Stephen Sinatra's work, as I mentioned, he's written a number of books. Yes. His first book was The Sinatra Solution. And I think that's been rewritten a number of times and updated. But then he has one, Heart Sense for Women. So it's very specific. Most of his work is geared toward women. And you'd find that if you looked at his website. Yes. So, and then he talks about, it's got another book, Lower Your Blood Pressure in 8 weeks. And some really good stuff. So I think if a woman has any sense about something going on with her or not, you don't have to think you've got something going on, but to get some information to avoid having something go on with your heart, I recommend him. I met him many, many years ago when I did my show, and he immediately came to mind when I knew we were doing this show.
Well, and speaking about shows, this is the end of this one. But I want to thank both you, Retha, for returning as you always do. And nice meeting you, Donna. And I really wish you the best in your future with whatever happens with your valve replacement. Again, I'm hoping you're not going to be having surgery again. That's my own personal wish for you.
I'm hoping that too.
Yes, yes. I guess as they say, at least, Retha, we're not going to be starting to take any special drinks to remove plaque. We're just going to take our brains and do the research. That's
hopefully follow the researchers' advice.
Yeah, exactly. So, ladies and gentlemen, tomorrow's slate of shows on Friday begins in the morning with with Philanthropy in Focus with Tommy D, Stephen Fry, Always Friday, and Matthew Asbell's Intangify. And then next Tuesday, you will hear The Hard Skills with Dr. Mira Brancu. And after Sam Leibowitz on Thursday with the Conscious Consultant Hour, I will be back again from another Hilton in Cleveland, Ohio. And we're going to be talking about artificial intelligence in healthcare with Maury Zelkovich. That all being said, thank you for watching this episode with me and Karen. She and I will be together again at the beginning of March with whatever tribute we're paying at that time.
Yes. Indeed.
Exactly. Indeed. And we will see you all next week. Thank you for watching right here on TalkRadio.nyc and all of our social media. Thank you, Logan, behind the scenes, for all that you've done literally before this show began. And we'll see you all next week. Take care.
Bye.
Bye.
Bye.